Good evening, everyone. Dr. Amita Ray will take today's session. Over to you, ma'am. Ma'am, you have muted yourself. Ma'am, please unmute.
Okay, thank you, Neha. Am I audible now?
Yes, ma'am.
Okay, am I visible also?
Yes, ma'am. Ma'am, please do it in the slideshow mode.
I put it in the slideshow now.
Yes, ma'am.
Okay, okay. Right. Okay. Uh, so, a very good evening to all the attendees and welcome to today's session. And again, I'll start by wishing everybody a happy new year. And although it is past, wishing you a very happy Makar Sankranti, Pongal, Lori, Bihu, all these beautiful harvest festivals that we have in India, and wishing you all the best. Hope you, all your and your families had a very good time over all these festivals. Am I audible, Neha, and am I visible? Is the voice okay?
Yes, ma'am. Yes, ma'am. Audible and you are visible too, ma'am.
Okay, thank you. So today my session is on assessment for competency-based education in obstetrics and gynecology. Now, when we talk about assessment and when we try to present a session on assessment, it is something like this cartoon here. What I mean to say is trying to talk about assessment and conveying the whole picture of assessment in a session of 30 to 40 minutes is like squeezing the genie into a small lamp. You know, the fairy tale like thing, the Aladdin fairy tale. It's quite impossible. However, like the fairy tale, and just like the good genie in the fairy tale, a good and robust assessment can make the curriculum excellent and fulfill all the wishes like a genie fulfills all the wishes. So, a good assessment will fulfill all the wishes of the student and the teacher. And that is why an understanding of the assessment is so vital to both the teachers and the students. Now, let us go on and understand the bottom line of assessment. So, we can talk about assessment, we can define assessment, we can elaborate on assessment, but let us come down to one single thing. What does it matter? So what? How does it matter? And that's why this slide of mine. What does it matter to the student? To the student, what matters is what the paper or what the examiner asked. Secondly, what he or she was able to answer or answered, and what are the grades or the marks that were awarded, or in case of a selection, was there a selection at all or was there not? These are the things that actually matter to a student in the form of assessment. And just like this cartoon, I bet when we were students and now that we have students, this is an incident that often happens. So the examiner is asking a question about Murphy's law, and the student is thinking, isn't that just typical? The teacher or the examiner will always ask me what I don't know. So this is from the end of the student. Now let us see what happens to the teacher. So to the teacher, what matters? To the teacher, what matters is what the student learned. We all know that. We have been teaching for since long, and we are always worried when we take a class, did the student learn? Was I able to convey the meaning of the concept of the thing to the student? And often it again happens as if in this cartoon. So if you see, this cartoon says that I taught Stripe, that is the dog, how to whistle. So let us imagine this is the assessor in the middle who asks, I don't hear him whistling. So the teacher says, I said I taught him. I didn't say he learned. Hasn't it happened to all of us? And many a time we keep on thinking, we taught this. We taught them details about fibroid. We taught them details about IUCD. We taught them details about PIH. We took a revision class also, and they have not learned it. So this is what matters in the context of assessment to both the teacher and the student. Now let us see how we can solve this problem, and my talk will be basically trying to avoid these situations both for the student and for the teacher. So the student does not complain that the question asked is the question that I don't know, and the teacher doesn't complain that I taught them so many times but they did not learn. So coming to the objectives of my session. So the first objective is to know what is assessment and what are the basic tenets or the basic principles of assessment. The second thing is assessment in competency-based curriculum different from the traditional curriculum, and how? Because now we have changed to the competency-based education. So we need to know the difference. And lastly, but not leastly, how do we, or how do us teachers apply the principles of assessment in order to have maximum utility in a CBME curriculum? Now, this word utility is a simple English word which simply means usefulness. How useful was my assessment to the whole CBME curriculum? Did it contribute to make the competencies come alive? So these are the three objectives with I will go ahead with my session. Coming to the first objective as to what is assessment and what are the basic principles of assessment. Now, assessment has been defined by learned teachers, by educationists in many ways. And as I told you, if we were to discuss that, we would probably take 2 or 3 days. But let us see a simple definition and a very appropriate one. And that is, assessment is the systematic collection, review, use of information about education undertaken for the purpose of improving student learning. So let us see the keywords here. So the keywords here are systematic collection. There has to be some system and method in it. Review, we have to see our results. We have to analyze our results. And after that, use the information. You see, this is the age of data collection, data, metadata everywhere. But is collecting the data only enough? No. You collect the data that is useful to you. And that is what is assessment. You collect the assessment which can be used for some purpose. And what is that purpose? That is improving student learning and development. So you have to see this definition in its holistic value, and that is what is assessment. And I hope you agree that this is a very holistic definition of an assessment. So let us now see what are the basic principles or the basic tenets of an assessment. And I will just enumerate them and begin with each of them separately. Alignment. Alignment of assessment. I'll come to that. Purpose of assessment. What is the purpose? What are the types of assessment? What are the characteristics of assessment? What is an assessment blueprint? And what are the tools of assessment? So beginning with the first one, assessment has to be aligned. That is the first principle every teacher needs to understand. Now, you have heard this word alignment many a time. That is putting in line. And what to put in line? The assessment has to be aligned with the learning objectives and the teaching learning method. Now, we have heard about alignment in another sense, and that is temporal alignment when we talk about integration. I'm not talking about that temporal alignment. What I am talking is to establish a robust relationship between objectives, teaching learnings, and assessment. In simple words, what you want your students to know, that is the objective. How will you teach them, or how will you make them know it, that is the teaching learning method. And how will you ascertain that your objective has been fulfilled, and that is the assessment. And each of them have a direct relation with the other. So you can see the bidirectional arrows here. Each of them has a direct relation to the other, and if you change any one of them, it will influence the other two, and you will have to change these two to keep the whole thing in alignment. And this is probably one of the most important concepts that curriculum designers, when they are designing a curriculum, have to keep in mind, and particularly if it is an outcome based curriculum, right? What is the next thing that is important about assessment? Assessment should have a purpose. Now, it is a matter of debate whether alignment is the more important or the purpose is the most important in assessment. I'm not going into the debate of that, but they are equally important. You see, anything done with a purpose has no meaning, and an important thing like assessment without a purpose will definitely have no meaning. That is why a teacher should always, before assessing, judge what would be the purpose. Now, let us see, even in everyday life, we are doing assessments. We taste a dish, we find it tasty. And what is the purpose? The purpose is that we will cook it and we will eat it more frequently. Why? Because it's tasty. That was our assessment. So the purpose is we will taste the dish or eat the dish every time. We see a dress and we start thinking or assessing, okay, will this dress look good on me? And if it is a yes, what we will do? The purpose is to go and purchase the dress and wear it. Very, very simple things. So if every simple thing has a purpose, the assessment definitely has to have a purpose. And let me see, what are the purposes with which we teachers do a assessment? Is it for a feedback? Is it for selecting the students, let us say in the NEET exam, or maybe anything else for that matter? Is it for licensing, the big regulatory bodies? And we know in the Western world, there's a system of licensing every 3 years, every 4 years. So is it the assessment for licensing, or is the assessment for a job? I'm not saying that this list is total list. There may be assessment for many other purposes as well, particularly educational assessment. But these are the few that we often deal with. Now you can see that there's such a wide variation in the purpose, and more important the purpose, more significant the purpose, the more stringent will have to be the assessment. The more better will have to be the assessment. And that is why the purpose of the assessment is very important. Going on to the next slide, and that is another way of looking at purpose. And what is that another way? We all know, as teachers, we have been reading about it, we have been doing it, we have been discussing it. And that is whether the assessment is a formative one, the purpose is formative, or whether it is summative. So is it an assessment of learning, or is it an assessment for learning? So let us see, what is the purpose of formative assessment? We all know, feedback. And maybe some of you have also heard these two words which have come up very recently, or rather maybe there and we have not noticed them. That is feed up and feed forward. So what is the difference between the three? Now, feedback simply means that you do an assessment to judge a person and you pass your judgment. You tell them that, okay, you did very well, or you did average, or whatever. That is the simple feedback. What is the feed up? The feed up is when you show the student their goal. That look here, this assessment is going to lead up to that goal. Feed up and up, right? And feed forward. What is feed forward? Now, feedback is just giving an assessment about how they did in the exam, etc. But feed forward means you tell them how to improve themselves. So if a person did average, you tell them how you can get better marks. If your student really failed, you tell them how you should get pass marks. And if a student was excellent, you tell them this is the things that you did right. And please continue to do that. So don't think that if a student does well, there is no place for feedback. There is always place for feedback. So feedback is a very important purpose of assessment. Now let us look at the other type of assessment, which is summative assessment. Now my question to you and to all of us is, does summative assessment have no feedback? Well, that is not so at all. Every assessment is an opportunity for a feedback and should be used so. That is what us teachers have to realize very well. Even if the exam is a total summative exam, let us say, for example, a NEET selection exam. You know what happens? There is no teacher there, there is an exam, and the student is either selected or not selected. So in that case, is there no place for a feedback? Is there no purpose of a feedback? Well, there is, I would say. In fact, it is the learner has to design a feedback to himself or herself. And it does so because let us say a student does not qualify NEET or does not qualify a licensing exam. What does that student do? The student goes, thinks about it, reflects on it, gives himself or herself a feedback. Okay, this is the questions that I did wrong. And so what do I have to do? I have to learn this, feed forward. And this is where the basis of self-directed learning and a self-directed feedback comes. And that is how a person becomes a lifelong learner. So now you understand the importance of a feedback, the purpose of the feedback, the purpose of the assessment, whether it is formative or summative, it needs a feedback. Okay. On to the next part, and that are the characteristics of assessment. What makes the assessment good? And these are the characteristics. Many of you who have done the revised basic workshop will be knowing these things. Sorry, I'm interrupting a little. Neha, am I properly heard and the slides are properly seen? Neha, Jayashree?
Yes, ma'am.
Are the slides properly going on and being seen?
Yes, ma'am.
Thank you. Okay, just sorry for the interruption, just wanted to make sure. So, assessment should be valid. And what do we mean? It should measure what it is intended to measure. It should be accurate, reliable. If we say a student is good when we take one case, the another case when we take the student, that also should come out as good. So consistency, the performance of the student is consistent, and reliability is a measure of consistency. Objective, there should be close agreement between two teachers or more assessors. So if I assess, it should be the same as Jayashree assesses or maybe any of you assesses, and that makes it acceptable. Because if it is not objective, we will not accept it. So objective and acceptability, there are many synonyms that are used here. The fourth point is feasibility. You can have many dreams, but are they feasible? Are they realistic? Are they achievable? Are they practical? Are they cost effective? So many tools are there of assessment. Not all are cost effective. So feasibility. And last but not the least, again, the assessment should have a good educational impact. It should motivate the students to learn. That is what education is all about. So these are the characteristics of a good assessment. Now let us see, can we fulfill all these characteristics all the time? It's a very tall order, I should think. But anyway, let us see another aspect of this. utility of assessment, usefulness of assessment. How useful is my assessment? And the learned people or the educationists have given us a formula. So validity into reliability, into acceptability, into feasibility, into educational impact is what is utility of assessment, the product. Now, let us see this product and let us analyze this. Now, this is a mathematical equation, and all the time, and probably never, we can apply a mathematical equation to a quality thing. So, the bottom line or the message that I want to give you is that it doesn't mean that if one of these is zero, the whole product is zero, because mathematically it would seem so. It is not so. It is not totally like that. But why this formula has been given is to emphasize to us the characteristics of a good assessment. So it should have all these things as much as is possible. Okay. Now let us come to the as much part of it. Now, ideally, an ideal assessment, if you can imagine all these characteristics should to be pots, these pots should be totally filled up to the brim. So they should be totally valid, totally reliable, totally acceptable, totally feasible, totally, and having a very high educational impact. This would be an ideal assessment. Again, a very tall order and may not be possible. And learned educationists say that is probably never possible. But let us see how we can tweak it to suit it to ourselves. Okay. Let us see if the purpose of the assessment is low stakes. You mean the stakes are low. Let us say it is just a classroom assessment. You are taking a class on fibroid, you are taking a class on PPH, and you ask a question, and that is also an assessment with the purpose of knowing whether the concept has percolated to the students. So in such a case, you have about 150 students in your classroom, and if you want to ask everybody the same question, that would be quite a difficult task. So here what we can see is that validity has to be there of this assessment. That means it should measure what it is supposed to measure. It should be reliable also, but it has to be, more importantly, it has to be feasible, because there are so many students that you have to cater to. The practicality, the cost effectiveness, the resources have to be there. And it could be low on acceptability, or it could be low on educational impact, definitely, because you are just asking one single question about one subject. It cannot have a huge impact. It cannot have an impact as big as the whole curriculum. So see, we have tweaked the assessment in this way to suit our purpose. Again, the purpose. Let us see another one, high stakes, a licensing exam. Now, in a licensing exam, you are giving the license to the person to practice. That's a very big thing. So the stakes are quite high. So you see, the validity, of course, has to be very high. The reliability, of course, has to be very high. The acceptability has to be high. The educational impact, because it's a licensing exam, the whole curriculum is there. The educational impact has to be high. But you see, the cost effectiveness, what will happen to that? It will be low, meaning it will be more and more costly. So see here, all these four things are there, but the cost effectiveness is not there. But the purpose of the exam has to be served, and that is how we tweak our assessment. So what I mean to say is that assessment has to be seen in this light. Now, if you note one point here, you will see, obviously, with the help of these pots, that every assessment should be both valid and reliable. And it is said that validity and reliability are the two pillars on which assessment is standing, right? And as far as possible, not to sacrifice them, because it doesn't make sense otherwise. Let me go one step further and say that if my life depended on one thing, if my assessment depended on only one single thing, what would it be? It would be validity. Because that is the most important characteristic of an assessment. It is judging what it is meant to judge. And if I would go on to say, I would say that validity is probably the foundation stone of assessment or the strongest pillar of assessment. If you are not judging what is meant to be judged, you are not assessing at all. A few words of caution here. Validity of assessment depends on the appropriateness of the interpretation of the assessment result. It is not solely dependent on the tool of assessment. It is actually an interaction of three things. We often say, oh, we used an OSCE to do it. We used an OSPE to do it. That is why our assessment will be 100%. No, the validity of the assessment doesn't depend upon, or does not only depend on the tool of the assessment. It depends upon several things. And what are these several things? It depends upon the assessor. It depends upon the tool. It depends upon the context. And all these are interrelated to each other. When they combine together, you get the interpretation or you get what is the assessment. So please do not think of the tools that we are using now as not useful tools or not valid tools. You have to use it properly. That means the assessor, and you have to look at the context, combine the three things, and then get your assessment. And that is what is the bottom line about validity. It depends upon all these three things, and each of these things affects the other, just like your learning, objectives, and assessment. One affects the other. So it is not simply the tool, not simply the assessor, it is all the things put together. Next point about assessment. Assessment can be made robust with a matrix, or what we often call as blueprint. You see, blueprinting is very important not only for teaching but also for assessment. What to assess? The subject specificity. We have so many topics in our OBG and Gynae. Which one to assess, which one to leave? What is the domain you want to assess? Which one is important? Do you want to assess the knowledge? Do you want to assess the skill? Or is it the attitude? How much to assess? To what level do you want to carry on these things? To what level do you want the nose to go to? You have the Bloom's taxonomy. Where do you want to take your assessment to? What is the grade to be given or the marks to be given? How do you decide a grade? Average, above average, excellent, very good? How do you do it? What is the tool you are going to use for assessment? So all these points combined together have to be put in a blueprint and judged accordingly. And that is what the basis of a good assessment would be. We make a blueprint for our homes. Where should be the kitchen? Where should be the basin? Where should be the other things? Where should be the chimney? Similarly, we have to make the assessment matrix or the assessment blueprint. About tools of assessment, I will not say too much about this because we as teachers have been using numerous tools, and there are numerous tools. What I would like to bring, the choice of this tool should take into account all the above principles that were enumerated before this. So you must, before you choose a tool, you should take into account the alignment, the purpose, the blueprinting, everything into account before you decide on the tool that you will select for assessment. And you should know about another word which is called triangulation. Now, triangulation was used by navigators to find a particular point. They would try to map it from this direction, from another direction, from the north, from the south, from the northeast, and come to a particular point and focus on that. So we can use our tools in the same way. Instead of using one tool, we could use 2 or 3 tools if we are really concerned about that competency or about that assessment. And these 3 tools will make us know the competency of the student, or will give us a better assessment of the student. And this is what is called triangulation. Okay. Now, let us come to the next section of my talk, and that is how is the assessment different in a traditional or a conventional curriculum versus the outcome based or the competency based curriculum? So we were till now following the traditional conventional curriculum and we were assessing according to that. Now we have changed on to the outcome based or the competency based, and how and what we should do differently so that the competency based medical education is a success story. Now, if I compare, if I want to say in one picture, because picture speaks 1,000 words, the conventional assessment or the traditional assessment is almost like this cartoon, where the person cannot see and the persons cannot see, and they have been told to assess what this is. And this is an elephant, and you know the story very well. So it is like groping in the dark because they are blind or they are blindfolded and they are just catching hold of whatever is coming in front of them, and then they are deciding, oh, this is this or this is that. But actually it is none of these things. It is an elephant, so it's not a fan, not a spear or a wall, etc. It's an elephant. So see, somehow the traditional assessment is like groping in the dark. We do not know what competency to assess, how much to assess, to what level to assess, etc., etc. And we do it as we feel is proper. It's not that we are doing wrong. It's not that we are doing wrong, but many a times we may go wrong because there are no guidelines to show us how we should assess. So let us see now. Now let us tabulate how the conventional differs from the competency-based assessment. The first one, as I told you, outcomes not defined in conventional. Here in the competency-based, we have outcomes well defined. The conventional assessment is fragmented. You know, one caught hold of the tail and he said it is like a rope, one caught hold of the ears and he said it is like a fan. But in the competency, it is integrated. A holistic picture of the total competency will be there. In the conventional, it is mainly summative, whereas in the competency based, and I will come to that in a little detail later on, it is formative more than summative. But of course, summative element is there. And there are several academic activities which contribute to the formative part of the assessment. And the last one is the approach in the conventional assessment is a normative approach as opposed to the criterion based approach in the competency based education. Now, what is this? I'll just come a little bit. Maybe many of you have a very good idea of it. Okay. Again, since we have our competencies well defined, we don't have to grope in the dark. We know that this is an elephant. Needless to say more. Let me talk about the normative assessment and the criterion reference assessment. What is the difference between the two? Now, normative assessment is a comparison of one student with the performance, one student's performance with that of the other students, right? It is a comparison between students. Whereas the criterion based reference is comparing the student's performance with a fixed criteria. You know, the criteria is fixed, it is not differing. So here we are comparing the students with that fixed criteria. In the normative, the assessment measures whether the student performed below average, average, or above average. See, when you are judging a group of students, you will see there is a mean value. Above mean, above average, below mean, below average. Not that in the criterion. The criterion measures whether the student was able to complete successfully the task that is defined by the criteria. If he cannot complete the task, there is nothing average or not average. It is yes or no. Lastly, as a summation, the normative assessment or the non-referenced assessment is a comparison, whereas the criterion based assessment is an actual assessment of the student's set of capability. Let me go a little further. And how does it work, right? Let us see a norm referenced. How it works? We set a pass score. We have set a pass score as 50%, right? In our exam, we say 50% just pass, below that fail. Let us say 60% is considered as average between 50 and 60. And if above 75, it is honors. See, but in the criterion based references, it is pre-decided the criteria of these competencies. So that student should be able to do this. And if the student cannot do it, he or she is not competent and he or she does not get the professional license. So it is always said that a criterion based assessment is much more better in case where there are high stakes. And I'm sure all of you will agree that the medical profession is a very high stakes profession. Now let us see the other point in the CBME assessment, and that is probably the most important part. That is the total emphasis on formative assessment. It is a longitudinal exercise rather than a cross-sectional exercise. What I mean is this, that when we do a summative assessment, we are doing a cross-section. That time, that day, what the student could answer, we are judging on that. How unfair. Whereas the CBME curriculum tells us to do a longitudinal exercise. From day one, we start assessing the person, we start assessing the student, and we come to the conclusion in the last whether the student deserves the license or not. And that is why it has been called a programmatic assessment, meaning the whole program or throughout the whole program, you are assessing the student. And this is how you can make the assessment correct and robust. And that is what CBME has been emphasizing time and again. And how we do it, I go on to that. Now, this is a diagram that I borrowed from Tejinder Singh's article, and how beautifully it describes the CBME assessment. So you can see this big, and he has made it in red circle. Why? Because this is where we have to work. We teachers have to work. The formative assessment, the feed forward, the feedback, and the feed up has to be funneled into this. And also the student has to inculcate self-assessment, workplace-based assessment, and reflections, all a part of formative assessment. And then in the last, we go on to decide whether this student can be qualified as an Indian medical graduate. A beautiful diagram which tells you, and thanks to our learned uh, educators who have given it, to show us what CBME assessment is all about. And how do the CBME assessment people have told us, how do we do that and what forms the backbone? See, we have log books for every subject. You can decide the competencies. We can all come to a conclusion. These are the competencies that the student has to learn, and that has to be assessed and longitudinally assessed throughout the curriculum. Integration of subjects and how the integrated module has to be assessed. A record of the foundation course, the reflections, which is again a part of assessment, the ATCOM booklet, which tells you, which asks you to assess each of these ATCOM competencies in the form of reflections, short answers, or whatever. The student doctor program, where from the third semester itself, the student goes there and maintains a book where he writes his experiences with the clinicians. The early clinical exposure, where again the student writes the reflection, asks questions, and gets the formative assessment from the teachers. So there are so many elements in this CBME program that contribute to programmatic assessment and formative assessment, and which forms the backbone of assessment in CBM. And now I come to the last part of my presentation, and that is increasing the utility of assessment in CBME, which is actually a summary of both the above two sections that I did previously. And let us see in summarization what we can see. A very strong emphasis on formative assessment. We teachers have to understand this very well. One single assessment is never can pass a good judgment. It has to be a continuous assessment and reinforced by feedback, feed up, and feed forward. The assessment should be valid, reliable, acceptable, feasible, and with a high educational impact. It is up to us assessors to judge the tool, to judge the context, and apply these principles. An assessment that is a longitudinal exercise rather than a cross-sectional exercise. This is what every teacher has to understand and not pass a judgment on a single assessment. Blueprinting an assessment matrix is very essential, particularly when we come to a summative exam. So if we want our summative exams to be robust and good and give the correct assessment, we have to design it as per a good matrix where all the elements that I told you about should be incorporated. Purpose of the assessment is to be well defined. If the purpose is low stakes, you can tweak your assessment. If the purpose is high stakes, you need to satisfy as many characteristics of a good assessment as is possible. And lastly, again, never leastly, your assessment has always to align with objectives and teaching learning methods. If tomorrow our competencies change and thereby the objectives change, we have to change our teaching learning and our assessment. And it can happen in medical science always. Today we have a pandemic, yesterday we didn't have it. Tomorrow we don't know how many pandemics we will have. The competencies that are required to deal with these pandemics or these situations will be ever changing, and we should be prepared to change our teaching learning and our assessment methods accordingly. So I come to the end of my session, and thank you for a very patient hearing. And you might be wondering why I have put this picture here. I just want to show you something. Look at this one on the left side. You can hardly understand what it is all about. It just shows you some blue dots and some light colored and some dark colored and some green dots there, again light colored. Here you start to get a picture about what this picture may be. Come to this third one. It again almost tells you, okay, probably this is the ground, this is the sky. And come to the last one, it tells you that there's this green grass with the blue sky above and clouds floating there which are white. And what is happening? We all have cameras, we know what is pixels. So you see, the resolution here is not good. The resolution here is beautiful. And what does the resolution depend upon? Pixels. More the number of pixels, more will be the resolution, better will be the picture, better will be your assessment or your understanding of the picture. And I want to say that more the number of assessments, more the longitudinal exercise, more the continuity of it, more the pixels of assessment, better will be your judgment of the student. Thank you very much. And Neha, I think if anybody can ask questions, I could clarify. And now we will probably go on to Dr. Jayashree, who's going to take up a competency and see how we could assess it. Rather, she will take up one of the objectives of the competency and see how we can assess it. So it is up to the participants to let me know through the chat box whether they have any questions for me, or should we go on to Dr. Jayashree's presentation. Please type in the chat box or raise your hand. And Neha, are you there? Neha, are you there?
I'm there, ma'am.
If anybody puts up a hand, or how do you organize that, please let me know. Or if you can see in the chat box.
Yes, ma'am. Ma'am, Dr. Tamkin is saying that we can have the discussion at the end.
I would first ask if any one of the people have got a question for me, and then I will go to the next.
Ma'am, Dr. Archana is also saying, thanks, ma'am, no questions.
Okay. So we'll go on to Dr. Jayashree's presentation, and I would ask Neha to make her the presenter, please. With me moderating the session, please.
Yes, ma'am, made. Ma'am, Dr. Jayashree is made the presenter. Please share your screen, ma'am, and unmute yourself, ma'am.
Thank you, Neha. Is my screen visible now?
Yes, ma'am.
Yes, yes.
Okay. Good evening, everyone. I thank Tamkin ma'am and Amita ma'am for giving me this opportunity to present whatever effort I have made in making this assessment interesting. Madam has talked about what we have to do in assessment. It is not setting the questions, and we have to concentrate on reliability, validity, and continuous assessment is the mode for CBME. So without much ado, I will go into the so this is the competency which I have taken for my for the discussion today. So enumerate and discuss causes, prevention, diagnosis, management, appropriate use of blood and blood products in postpartum hemorrhage. This is a knows how. It's a core subject. Teaching methodology of small group discussion and bedside clinics. And our CBME curriculum tells it has to be assessed both in written as well as in skill assessment. So these are the various objectives we have under the topic of for this competency of postpartum hemorrhage. Out of which I have taken very few competencies, very few objectives for assessment. Actually, what Madam has told about blueprint for the whole subject per se, which is considered as important, which is most frequent or important topic like maternal mortality and all those things. So based on that, we'll be preparing a blueprint for the whole subject, whole obstetrics. And for the topic also, we can take a blueprint. Which are the topics we are going to assess formatively, and which are the topics we are going to assess summatively, and how much marks we are going to provide for each of the objective. So this is one of the single best answer which we can include in our lecture itself or a didactic session itself, maybe at the end of the session or at the beginning of the session, because this if it is a phase 3 part 2, we can have it at the beginning of the session. If it is phase 3 part 1, we can have it at the end of the session. This formative assessment, because it will be considered as formative assessment, because we are right now the batches which we are having are not competency based, so they don't have objective questions in their question book for the summative exam. So we can use it as a formative assessment. Or we can give a picture and ask them to arrange it in order, the maneuvers which we use in the PPH management. So this is also a type of assessment using illustrations. So this is usually the type of structured essay questions which we use in our summative exam assessment. So 28-year-old gravida to para 1 with moderate anemia delivered spontaneously and alive 2.8 kg baby. So enumerate the cardinal steps of active management of third stage of labor will be one structured answer. And then she delivered placenta within 10 minutes, but bleeding appears excessive. So define postpartum hemorrhage or describe the first line agents used in the management of postpartum hemorrhage. So this is called as a structured essay question or a constructed response question. So you would have wondering why I have written this question and encircled it. Explain the clinical examination in detail you will undertake to differentiate the various causes of postpartum hemorrhage. So that's what Madam has told, right? Whether it is valid, because we want to, we cannot ask the student to write down the steps of clinical examination, right? We want them to demonstrate and show what clinical examinations they will do. So instead of asking them in a theoretical aspect, we can do it in a practical aspect. And it is difficult to assess for each and every one. So what we can do it, We can do it as a team assessment also, because it is going to be a formative, and this is a core subject, and because it is one of the causes for major cause for maternal mortality, we have to do the assessment, right? So demonstrate timely and accurate clinical intervention for a postpartum hemorrhage in a simulated environment. So this is my objective. So this I'm going to assess in a simulated session with checklist, and this will be team. So maybe a team of 3 to 4 members who will do the management of postpartum hemorrhage drill. So this will be my checklist. So these are the steps which I will be assessing the students on. So I will just see whether I have observed all these steps or not observed, and if they make any mistakes, or whether I want to give them any feedback on each and every one of these steps, I will write it down here. So at the end of the session, I'll be able to give feedback to the students. Ma'am, I will stop with this competency, ma'am, so that we can open for discussion. Amita, ma'am, Pumpkin, ma'am. Am I audible? Ma'am, am I audible?
Yes, ma'am, you are audible.
But ma'am, Amita, ma'am, Pumpkin, ma'am.
Yes, you're audible, Jayashree. You're audible.
Ma'am, can we go for discussion here, or I finish off whatever I have prepared, ma'am, on assessment?
Okay. If we have any question, we'll go for discussion. Yes. Anybody is there in the chat box or WhatsApp?
Ma'am, there are no questions in the chat box. Ma'am,
Okay. Right.
Dr. Tamkin is unmuted. Please, ma'am, you can speak.
Dr. Tamkin, we are waiting for you.
Hi, Dr. Amita and everybody. Good evening. I was just, I was muted, that's why I couldn't respond. Dr. Jayashree, you have made a very good, checklist that you gave for assessing formative assessment during a role play or a drill on PPH. And where is that? Yeah. But whenever we are talking about, more assessment, like Dr. Amita said that there has to be more assessment, more the better, and more the tools that we use, we get a better picture, a more clear picture. So when you use this sort of a test, a checklist, we have, what I just want to add here is that maybe 4 people are participating, you will need 4 facilitators to be observing them, and each is marking one. Okay, because single person will not be able to mark this all 4 of them together. So there has to be one person who's doing the overall assessment and you need at least 4 other people to mark the other 4 people, the participants, all the participants individually, so that we can give specific feedback to each and every individual. And that is why the need for involving our postgraduate students, our senior residents in teaching learning activities, in assessment, and in delivering the curriculum as a whole. So I think we can move forwards.
Okay, ma'am. Thank you, ma'am. So this is the next competency which I have taken. So observe and assist in the performance of an episiotomy and demonstrate the correct suturing technique of an episiotomy in a simulated environment. So this is also a skill assessment. So for this, the objective is demonstrate the correct suturing technique of an episiotomy in a simulated environment. Since we cannot do this for 150 students for a summative assessment, this we can do it gradually only in a formative assessment. So I have taken this as a formative assessment. I want to assess each and every individual separately. So this I will be doing it with an OSCE and a checklist. So these will be my points which I will ask and assess each of my student to do it. So this I don't have to do it personally also. Even my OT staff nurses also can be involved as a standardized examiner to assess these things. So this assessment can be done in that way also. Next, coming to the next competency, enumerate the indications for describe the steps and insert and remove an IUCD in a simulated environment. This is going to be a skill assessment, but I want this to be incorporated in a summative assessment because for the CBME part, we are going to have OSCE. So that's why OSCE is always with an examiner and also with a checklist usually. So what we see nowadays where I go as examiner, they tell it is OSCE for 30 marks, but what they do is all these stations are usually for undergraduates. They are unmanned stations. Usually unmanned stations, we don't assess the students. OSCE is literally each and every station should have an examiner. So this will be the objective, demonstrate insertion of an IUCD device in a simulated environment. So these will be the checklist which the person who is sitting there will be assessing whether the student is doing it in a correct manner or appropriate manner or according to the steps which is given in the checklist so that they can mark it objectively. So the disadvantage with this OSCE is we need as many examiners as possible. So we cannot incorporate OSCE per se in our exam as I feel. So what is the feasibility we have? We have for the practical exam, still we can go ahead with our long case and short case. I think most of us will know this is one of the Likert scale which is used by the Australian exam for postgraduates actually. So they have divided the long case assessment into 6 parts. So clinical examination, history taking, clinical findings and interpretation, short-term management plan. They ask questions based on impact of the illness on patient and family, long-term management plan, and they mark accordingly. And if they have not observed anything, they just observe it here. Or the time-tested method for long case assessment is a OSLR, which we can use to assess our students both subjectively and objectively. Ma'am?
Yeah, can we have some? Yeah.
Yes. So in this context, there is another tool, Dr. Jayashree, and that is the Mini CEX.
Yes, ma'am.
They say that Mini CEX is one of the tools that are used for workplace-based assessment. And if that is tweaked a little bit, we can use it absolutely like the OSLR. And the OSLR is the objective structured long examination record. To be the whole form of it is that. And actually it is a long case presentation which is a bit structured, and being structured it gives it a little objectivity, so the acceptability is high. And that's why one of the dictums of your assessment which says acceptability should be high, objectivity should be high, both these things get a bit of which get fulfilled, what I mean to say. So the OSLR, the Mini CEX, and our long case, which we have been traditionally taking in our exams, are almost similar with a little here and there. And that is why I wanted to emphasize that not everything that we are doing is wrong. It is not that. Many of the things that we are doing are quite robust. And having to have an OSCE for 150 students, even one OSCE, would be quite a Herculean task. And that would probably be more feasible in the PG setup rather than the UG setup. Having said so, still, if we have a competency which really we think is life-saving to our mothers, we could design OSCEs and assess our every student on that OSCE. That's all.
So I would just like to add that mini CX is when you're doing it in a real situation, and you're doing something at the same time.
Workplace-based assessment. It is a workplace-based assessment, and that is what I said. But it could be tweaked, and the Americans have tweaked it to suit their Osler records also.
Okay, so you are doing it in a real situation. For example, you are actually sitting in the labor room, or you are actually doing it in the casualty. That's the difference, and you get a more real life, feel there. How the student will, maybe he has done a lot of practice and he's doing it right as an OSCE, but in the actual situation, when there's a crisis, he's not able to perform as well. So it will give you a better picture of the student's actual capabilities for a competency-based curriculum. What I was talking about, can you go back to your slides? The one where you gave us a checklist. So you said, yeah, you had one suggestion, yeah, that this checklist can be used for assessing students for skills, and you could train your staff. I think this checklist can be a very good tool to be used by the student themselves on one another while they are learning that skill during that session itself. And what is your view, Jayashree and Dr. Amita, and if the other people are there from the faculty, whether we should be sharing the checklist with the student or not?
I think we can share, ma'am. Actually, most of the studies they tell peer assessment actually improves the student skill as well as knowledge much better. That is a valid suggestion.
Yeah, should we share the checklist with the student or not during the training itself? What would be your suggestion?
We should. So
the
purpose of assessment is not to fail the student. The purpose of the assessment, the purpose of all the educational activity is to make good doctors. And if we share the checklist, it is not called cheating or anything, because each of this is a skill that they have to learn. So they will know that this is the thing, or this is the point on which they will be assessed, and they will make it a point to get it correct. And that is the basis for sharing the checklist.
So one disadvantage, definitely I would want to share the checklist, rather the learning guide with the student, not the actual checklist that we are going to use. That is a more expanded version, that is a learning guide. And I would advise the students to use it on one another for learning during the process of learning itself. But I would like to share some experience of OSCE exams. It's not very easy, like you all said, not very easy. It's a Herculean task, like Dr. Amita said, to be performing an OSCE on 150 students. So there are many ways of doing the OSCE and many modifications of OSCE, how to test 250 students even. Because as per MCI regulations, you cannot test more than 30 or 35. So there's a limited number of students that you can test in a particular day. So it is not very difficult to arrange an OSCE, simultaneously dividing those 35 students into 2 batches and having exactly similar OSCEs at the same time. So sometime maybe we can have a session on how to organize an OSCE exam, because now it is so gaining so much importance. But the thing is that the OSCE becomes a very dangerous tool when you start sharing the checklist with the student, and when they know that not every subject or every topic or every skill or every competency can be tested, or arrangements can be made for each and every skill. It is not possible. For example, when I was working in a institution where the curriculum was totally competency based, they had limited number of mannequins. So the students knew that only these 4 checklists or learning guides are important, because the others we will not have enough mannequins. We will not have that particular type of mannequin to be arranged. So if the topic is very important, like Dr. Amita said, it is definitely very helpful that the student gets a very clear message that this is very important part of the examination, the final assessment. because that makes the student learn. It is their assessment which is driving their learning. But again, there is this disadvantage that when it is not possible to arrange OSCE for each and every aspect of the competency, and then the student gets, automated. They know that this is these competencies are important, and this part of this particular competency is important because that can be checked with the OSCE. So sometimes that, that acts against deeper learning. Yes, we
Ma'am,
can.
one doubt, ma'am, here. Ma'am, you told OSCE for even 30 students, ma'am. Usually we have only 4 examiners at the maximum.
No,
How
they are
does
math
OSCE
stations, interactive stations, and there are observe stations. So observe student, you can just make any postgraduate with a checklist for observe student. Then the unobserved student, the student moves, isn't it? And then the third is the interactive student, the interactive OSCE station. So for that, you will need examiners.
Okay.
So maybe 4 will be enough. But if you have 35 students, you make 12 stations. Exactly, you replicate those stations. But again, then you have to have lots of mannequins of the same type. You get my point?
Yes, ma'am.
Yeah. So in 2 different halls, exactly similar stations are there, which are being run at the same time. So 24 students or maybe 36 students can be tested at the same time. And it finishes so fast. It is worth the effort. Because once you start it, yeah.
Now, I would like to come in here. I think Jayashree is very right in the sense that it is very difficult to conduct a proper OSCE there. If you are really looking at a competency, it will have several things in that. It will have a skill, it will have a knowledge, it will have maybe an attitude, all these things. And to judge one such competency for with the help of an OSCE for 150 students in the Indian scenario becomes very, very difficult. Even if you enlist the help of maybe people who are non-medical, let us say our nurses or anybody, where there's just a checklist. So it really becomes difficult. What at the most we can do is a part of that competency in the form of an objective can be tested as an OSCE. Now, again, when we are talking about OSCEs all the time when we are talking about OSCEs, we have to see whether designing OSCEs is really worthwhile. Are we increasing the critical knowledge skills? Are we increasing the critical analysis skill? Because that is what has been neglected for a pretty long time. We'll have, when we talk about deeper learning, we mean this only. We have to take from the knowledge level to the analysis level. That can very well be done by written questionnaires, scenarios, extended multiple choice questions, where you keep asking questions on scenarios. If you have a very skill based competency, there your OSCEs will be really helpful to check point by point. Let us say like tying a square knot. So that could be checked by an OSCE, that would be very good. But tying a square knot is just one objective. It has to be combined with several other things to become a competency. And I think for an undergraduate, we have to develop critical thinking, diagnostic thinking, use of applying these investigation results to a particular patient, taking the history properly, doing the examination. These would be more and more helpful for students. Of course, there would be certain competencies where undergraduates must know, like a PPH. There you could design an OSCE, a particular part of an OSCE. But having said that, you would not expect an undergraduate student to do a stepwise devascularization. So at the most, when you design an OSCE for a skill level for management of PPH, you should the student should be able to put an IV cannula fast, should be able to arrange for blood, should be able to give an IM injection, an IV injection. Those would be the more important point. So again, a lot of hard work has to go on into designing OSCEs which are meant for undergraduates. Here we are only talking about undergraduates, and that is the purpose of our assessment here.
So I would like to share the way we conduct it in our department. We have a batch of 150 students and 35 are tested in one day, the way we arrange it. And the greatest disadvantage with OSCE is that only you can only assess a part of a particular competency. You cannot assess the whole of it. You just ask somebody to demonstrate counseling a person for contraception, or explain to a mother how to use the what is that, the bronchodilator, or you always have to do it in parts, and that is the greatest disadvantage with OSCE.
Dr. Tamkin, I think maybe anybody else would like to express their view. Dr. Shobha Goody is there. I think she wrote in the WhatsApp. If madam would care to say a few words.
Actually, I'm not able to see. Oh, wait, I was just seeing that there are 39 attendees. Yeah, Dr. Anjali is there. She's raising her hand. Dr. Anjali, please unmute yourself.
We will mute ourselves, Dr. Tamkin. Let Dr. Anjali talk.
No, but somebody has to unmute her. Who's doing that? Neha, are you there? Dr. Shobha has raised her. Dr. Satinder has also raised his hand. Please.
Can you in the meantime write in the chat box, please? And Neha, are you there? Can you please unmute some?
Yes, ma'am, I have unmuted Dr. Satinder.
Okay, Dr. Satinder, can we please ask, express your views or ask your question, whatever it may be?
Yeah, good evening, ma'am. Good evening. Yeah, I absolutely agree with the ma'am, both of you, that it is not possible to totally change the assessment process because the number of students is very high, and number two, it is very difficult to judge the OSCEs on so many students. And the third disadvantage we noted when we took the exam, that suppose we have made 30 OSCEs for a batch of students today, and because we could make a limited number of OSCEs, so the next day almost 80% of the students were already aware that these were the like stations they were put in, and there could be a slightly the assessment of the next day students were much better than, because they could already know that these were the most of the OSCEs those were asked yesterday. So
okay,
I mean,
Dr. Satinder.
Yeah.
Dr. Satinder, yes. Can I come on this point?
Yes, ma'am.
The point here, again, as I said you, assessment yes, for learning and assessment of learning. So,
yes, ma'am.
Actually, I think I should congratulate you by saying that whatever you wanted to teach through that yes, OSCE, almost yes, all the students learned it.
Yes, ma'am. Yes.
They wanted to get good marks in the exam. So actually, yes, as teachers, a lot of our purpose is served.
Yes, exactly, ma'am. Yes. So disadvantage or the advantage. Yes, ma'am.
If any of you heard what Dr. Ronald Harden actually gave a talk.
Yes, ma'am.
Dr. Ronald Harden gave a talk very recently, and exactly these questions were put to him by many of us. That if we give the checklist to all the students, so what yes, is the fun? Everybody will do well. So he said, yes, let everybody do well.
Yes,
that is the purpose.
You are right.
We need to teach the students to do well on the patients.
Yes, the purpose is solved.
I think you could look it either ways.
Yes, ma'am. You are right. You are right, ma'am. Okay.
Satinder, I would like to add that here the answer is having 30 OSCEs is the answer is to have 60 OSCEs of exactly the same, including from the same topics, the must know areas, and of equal difficulty level. And that is why the department, all faculty members have to sit together and decide and do a lot of homework in order for our assessment to be right.
Yes, absolutely.
So that's the answer. Yes. So example, you have 5 topics. You want to include that in assessment. You have to have 5 different questions of equal difficulty levels for the 5 days.
Yes.
So that
actually, in the process we are also learning to be smarter than the our students.
Yeah.
Yeah.
That's
Yeah.
the spirit.
That is
Yes.
exactly
Yes.
what, and in the
Yes.
process, you are training the students to in the competency that you really require them to practice in the society.
Yes, ma'am. Absolutely right. Yes. Yes, ma'am. Thank you, ma'am. Thank you.
You are welcome. Anybody else wants to express?
Yes, ma'am. Dr. Anjali Kanhare, Dr. Shobha,
Please
they are all
unmute them.
unmuted.
Okay.
Dr. Hemant Damle.
Uh, Good evening. Am I audible?
Yeah, you are audible.
Yes, you
Hello.
are audible. Yes.
My only problem is when we think about, I'm totally in for giving the checklist, but my only query is when we want it to be a behavioral change for the students, uh, like the query was that we are going to ultimately teach them and they will learn. My problem is whether learning at the last minute, will they be able to retain it? That is what is my query.
So the formative
You are
assessment is going to that.
Yeah,
Ensure
like
that.
you are giving it for your OSCE and you are putting the stations, and as madam told that they are all aware what the questions are going to be. They read for that same day, they come back and they do very well for the assessment. But whole purpose of putting all this is to make them uh, use it in their change in behavior, or they need to imbibe them in their everyday like in the profession. Whether
Okay,
we'll be
Madam,
able to
can,
achieve
yes. Can
that.
I come in
Formative
on this?
assessment, because
Yes.
yeah,
Yes,
comes
ma'am.
See, everything you are not going to judge by an OSCE, are you? Everything you
Yes.
are not going to
True.
make a checklist, are you? No.
No.
So you're not going to make a checklist for everything. You're not going to make an OSCE or an OSCE for everything. So, and I talked
Mm-hmm.
to you in my talk about triangulation. Now,
Yeah.
triangulation means that you use different tools to assess a particular
Mm-hmm.
thing. So if you
Okay.
feel that that helps you, you could use
Mm-hmm.
triangulation. It means more work for you, definitely, right?
Mm-hmm.
Or else you could vary your OSCEs for every exam. Let us be, if you are talking about if you're talking about a formative exam, you decide you can make OSCEs in such a way that
Mm-hmm.
these are the essential competencies that you want your students to learn, and you can keep
Okay.
on repeating them because it's a formative exam. What you
All right.
ultimately want
Okay.
is them to learn it. Now, when you go on to a
Absolutely.
summative exam, that's what I'm
Uh-huh.
telling you, that when we do an assessment, we have to judge what is the purpose of it. Now, when you're doing it
Okay.
for a licensing exam, you can
Uh-huh.
vary the situation. You can
Okay.
increase the difficulty level. You can add more
Yeah.
competencies which was not shown before. And
Yes.
you're not going to do
Okay.
everything by OSCE. You will have thinking questions there. You will have case scenarios there. You will be having multiple
Mm-hmm.
choice questions there. So you're not judging the student on one single OSCE.
Okay, ma'am. Yes, got it. Got it. Thank you, ma'am.
That's why when I talk to you about assessment in general, we have
Hmm.
to see all the characteristics that were put there. Meaning you have to see the
Okay.
purpose of the exam. You have to
and that is
see
why
Sure.
what you are trying to achieve. Are you trying to make your students learn, or are you trying to
Mm-hmm.
now give them the license and finish off with the course, something like that? So everything
Okay.
has to be seen in that light. And triangulation
Okay.
is a thing that is used by many people. Like when we do research also, we do a quantitative
Mm-hmm.
plus a qualitative research and triangulate and see whether both of them corroborated each other.
Okay. Yeah.
besides we are focusing
Thank you.
also on
Thank you, ma'am.
formative assessment.
Thank
We
you.
are focusing a lot on formative assessment, and that is what it is ensuring that the student actually learns. Because
Dr. Shobha and Dr.
learning
Damle.
guide, the same learning guide will be used for the student while learning, and you are giving immediate feedback.
Dr. Damle and Dr. Shobha wanted to speak, please. Can we have them?
Dr. Damle, please unmute yourself.
Yeah, I am unmuted. Can I speak now?
Yes, please, please. We are waiting to hear you.
Dr.
Yeah,
Sabita is also unmuted, ma'am.
I am in the opinion of reversing the process, I put myself as a student, and the first thing as a student I asking how they are going to assess me. In fact, whenever you write a competency, the first thing you ask yourself how I am going to assess it, whether by
Absolutely. It is
OSCE,
the
whether
tail
by
that wags the
SEQ,
dog.
by MPQ, and then if you are going to assess the method, then let the student know how what are the questions, what are the points in the OSCEs, and then student will learn. We are here to make the student learn faster, quicker, and in a better way. We are not going to make them surprise or hide something or something. That is the best way to learn once you know what is the target, what is the question they are going to ask. If
That is
you have a question bank of 10,000 questions, keep it open and you ask 100 out of it, your purpose is served. Whether the question bank is in the form of SAQ, LAQ, MCQ or OSCE. Keep your question bank huge, cover everything and let it be open for all students to see. That is my opinion. Thank you.
This is exactly how the USMLE exams are done, Dr. Damle. You are absolutely right. We have nothing to hide from our students. Rather, we have to be an open book and tell them that, look, this is something you have to learn. We are telling you, we are going to ask a question on this. Absolutely.
Okay, thank you. I'm muting myself.
Anybody else would like to speak? Please give their opinion.
Dr.
Dr.
Indira.
Sabita?
Dr. Indira is unmuted, ma'am. Dr. Sabita, unmuted.
Drs. Indira, Dr. Sabita, are you able to unmute yourself and talk, or would you like to put it in a chat box?
Ma'am, they have initially asked questions in the chat box, but
Okay.
now they are not unmuting themselves, ma'am.
Oh. What is the question? I don't see any question in the chat box.
See now, ma'am.
No, there's nothing in the chat box.
One more doubt, ma'am. The
Yes.
discussion, key and everything.
Yes.
Ma'am,
Yes.
this usually our essay questions in most of the universities, they are all well written, ma'am, well structured. But
Yes.
our short notes are like 1 or 2 words, like IUD, intrauterine death, postpartum hemorrhage. And the students write whatever they want, and we are forced to give marks without knowing what we wanted from the students. So why is that happening everywhere, ma'am? We are not asking our short notes in an writing the short notes in an
Yeah, actually, this is a very difficult question to answer, Dr. Jayashree, why it is happening, but it is happening. And actually, something that was told to me quite some time back when I was doing my course in MHP at Dundee. They said, when you ask a question, make it a point to write a model answer, because if you write a model answer, you yourself will know what you are asking. Otherwise, when you just, as you say, write a short note on PPH, you yourself do not know whether you want to know the causes of PPH. Do you know want to presentation of PPH? Do you want to know the medical management or the surgical management? And it is very difficult. And if it is difficult for you to understand your own question, how do you think the students would interpret it? So they always told us that whenever you write a question, you write a model answer. Now, what happened when they told us this? There were some of us who used to write, ask for short answer questions like you said, PPH, IUCD. Then we started thinking that if I was supposed to write, what should I write in that? This is a short note. It is just a question. It's an marks, 3 marks or 2 marks or whatever. I cannot write a whole 3 or 4 pages on it. So how should I do it? That is what made us realize, as Dr. Damle said, that think of yourself as the student. And that is what made us realize that yes, we need to give the student direction. as to what the student needs to answer. And I still, this practice is being done, but I think slowly it is changing, that people are becoming more focused on asking the short questions that write the etiology only, or enumerate these this thing, or write only the medical management, something like that. But I guess changes do happen, and they do happen quite slowly, and we have to be a little patient till everybody changes. I guess that is the answer to the question.
Thank you, ma'am.
So any other question is there?
Ma'am, it's done, ma'am.
Okay. So thank you, everyone. Shall we close the session? Dr. Tamkin, Dr. Damle, shall we close the session?
Okay, thank you, madam. Very nice lecture, very informative. We can
Thank
close.
you, Dr. Dam. Thank you very much. Dr. Tamkin, are you still there, or? Okay, Neha, I think we can close the session.
Fine, ma'am. Thank you, ma'am. Thanks a lot.
Thank you. Thank you.
Sorry, I got busy with the call. I missed the last part of the discussion, what Dr. Damle was saying.
Should I end, ma'am?
Yeah, I think Dr. Amita already left. Okay.
Okay, ma'am.
Bye-bye.
Fine, ma'am. Thank you, ma'am. Bye.
Thank you. Thank you.